Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you're watching KK Med Talks. Today is a special day because we'll talk about something very hot, a very hot topic. And if we have a hot topic, then certainly we need a very hot speaker. But now I wonder how our speaker would react to this introduction. So let's welcome Professor Anuj Maheshwari from Lucknow, someone who has kept the flag of India flying high, not only throughout the country, but across the globe as well. Warm welcome, Dr. Maheshwari.
Hi, Dr. Sanjay. This is fantastic to be here in your show. I
Namaskar,
think
sir.
we are having a conversation with for the public, so I can speak Hindi also.
Yes, Hindi, English, Bhojpuri, every language is welcome,
Combination.
sir. Avadi
Yes.
also. Yes.
Yeah. Right.
Professor Anuj Maheshwari is a professor of medicine at Lucknow, leading policymaker and opinion shaper across the country and beyond as well, because he is governor of the American College of Physicians India chapter. And under his tutelage, under his presidency, the Indian chapter has won so many international awards, and Indian doctors have won so many awards, it's difficult to enumerate. So there are some people, who do a lot for themselves, and they will have 100 or 1,000 publications. But then there are others who work for yet other people, unknown people. And to Dr. Maheshwari would go the credit of having launched hundreds of Indian physicians at an international level. So thank you, sir, for your services.
Yes.
Sir, you
It's
have
really great.
greetings coming your way as well from across the country. And like you said in Hindi and English, of course, but also in Avdi and Bhojpuri, lots of people greeting you. But a question is, we said that today would be a hot day, a hot topic. So, sir, how frequently do patients come to your clinic complaining of heat, complaining of fever?
Yes, a lot of patients are coming with the fever. Fever is a thing which a clinician come across I think every third, fourth patients we come across, may it be diabetes, may it be hypertension, but fever is a thing which will definitely be coming to our clinic. And obviously the age-old medication and most popular medication is the paracetamol for the fever. And obviously majority of the patient gets paracetamol for the fever, but obviously compliance remains a issue whenever we give the paracetamol, because 4 times a day or 5 times a day is really not very easy for any person to follow
Yeah.
in today's busy schedule. So definitely there is a challenge with the paracetamol. Although I never found any difficulty or any side effects from any patient in my life from the paracetamol.
Dr. Dinesh Pal, Sarthak Arora ji and Palit Kumar Azad, thank you for your comments. And Dr. Nanlal Sharda, sir is a senior physician from Ahmedabad. He sends you his blessings. Akhil Vadva and Mimil Dahal are also with us. And Saurabh ji और Ahish ji पूछते हैं कि sir, with the paracetamol, the effective dose is sometimes 650 milligram. So how easy is it for the patient to swallow that? Have you faced problems with that? Patient coming and complaining that, sir, the tablet size is so large, I find it difficult to take.
यस, मैंने अभी यही बात कही है. आई जस्ट सेड दैट कि compliance always remains a big issue, because 650 mg giving 4 times a day every 6 hourly to be following in busy schedule. Although whenever a person is having fever, we always say that take rest, and during rest a person can take the medication when he is at home, but still there is one dose which will come in the midnight, and that be a challenge for any person who is not well and he's sick and on the bed, so he will be having a tough time to take that, and many a time it is missed.
So one issue with paracetamol is the size of the tablet. The other one is the frequency of administration, a 4 hourly or 6 hourly administration.
Yes, yes.
There's another question from Rahish, Raju, and Narendra ji, and Shamsher Bahadur Singh ji भी हमारे साथ हैं. Mohammad Rashid ji को बोलेंगे, if you're fasting, we wish you a very fulfilling Ramzan fast, and hopefully अब तक रोजा टूट गया होगा या टूटने वाला होगा, depending upon where you are in the country. तो सतीश जी और रजनीश जी भी पूछते हैं कि what about pain? Do patients who come with fever come only with fever, or do they have other symptoms as well, like pain in the muscles, pain in the joints, and how do they react to our treatment if we were to use only conventional paracetamol?
If you talk about the paracetamol, I am the big fan of the paracetamol in one way or another way, even for pain also. My many patients gets very good results from the paracetamol, even in pain also. I tell you, my mother, who is 80-year-old, having the osteoarthritis, having the neuralgia, a lot of things are there, and she was being treated by the uh, orthopedic surgeon, rheumatologist, neurologist together. And she was not getting relief. I just asked her that paracetamol, and she got the relief. So I am having personally my trust definitely on the paracetamol, but many of my patients. But obviously the compliance issue is there, and obviously the pain, it is not very strong pain reliever, but many times I found that paracetamol is very good muscle relaxant, and most of the time we get pain which is because of the stiffness of the muscle or stretching of the muscle, where this drug works very good and people gets relief even with a single tablet.
Satish Mehtaji and Rajneesh and Mohammed Motasim sir ask you, sir, mefenamic acid is an age-old drug, an NSAID, and it has not only antipyretic, that is anti-fever, but it also has analgesic, which is pain relieving, and anti-inflammatory effects. So a triad of mechanisms of action. It reduces fever, it reduces pain, and it also reduces inflammation. So, what is your opinion about this, sir? And how many years of experience would you be having with mefenamic acid?
Yes, definitely. I should say that mefenamic acid is a underused drug in our country. It should have been used more as far as these properties are concerned. It's a very effective pain reliever, very effective antipyretic, and that too in the much lesser doses than regular antipyretic what we use in our day-to-day practice, like paracetamol. And it is even having the antiviral property also. So many a times in the viral diseases, we don't offer any direct treatment like we offer in bacterial, like antibiotics. So we don't offer any direct treatment in the viral diseases usually. Like we don't offer any antiviral. So if any medication we are giving which is having some antiviral property or broad spectrum kind of the antiviral effectiveness or a quality, then obviously it would be a good to use for that. But most of the people don't know about these properties, and most of the people have not used them for these reasons, so they don't use them. So I believe that mefenamic acid could be a better option for situations when we are using this, especially in the pain when it is associated with fever.
And most of the time, the fever that we encounter in our clinics, and greetings to Amarjit Prajapati ji, Suresh Ram ji, and Raju Kumar ji as well, also Ashish Singh. Most of the times, the fever that we encounter is of what you can call unknown origin or usually viral. And of course, there would be 33 crore types of viruses as well, DNA, RNA, and you cannot kind of identify which one it is. But when you know that mefenamic acid has antiviral property as well, apart from its fever lowering, pain reducing, and anti-inflammatory effects, that actually makes it a drug of choice. Sir, there is a word that is used in modern medicine, in medicine now, and Rajiv ji and Ajay Tripathi ji ask you, sir, inflammasome. Does the cell change actually when inflammation occurs? And can mefenamic acid actually influence the inflammasome of the human body, someone who is going through fever or pain?
In fact, inflammasome is a part of our innate immune system, which helps in reducing the inflammation by releasing the inflammatory mediators or inflammatory anti-inflammatory cytokines or interleukin 1 beta, or they may help in working for the inflammation. Inflammation is also a protective phenomena for the disease. Whenever a bacteria or any outside thing which is attacking on our body, maybe virus, maybe bacteria, maybe any other organism, it inflammation protects our body by doing that. So it is a part of the immune system, and it helps in inducing those pro-inflammatory markers or with pro-inflammatory things, or you can say chemicals, and in response to those infections, or the microbial infections, maybe the viral infection, or which are causing the cellular damage. So they are actually released in the response of the cellular damage, and once they are more in the blood, we can say that the level of the inflammation is increasing, and we can say that the patient is requiring anti-inflammatory medication. And whenever we are using the anti-inflammatory medication, it works well in the presence of these inflammasome. And mefenamic acid is also one of that which works against these inflammasome very well without making any additional side effect. And that is the beauty of this molecule. If we use them, we can get the inflammation reduced wisely.
That's very important. Like you said, side effects also don't occur. And Ashish, Nagesh, and Devesh wish you a good evening, sir. Uh, Apart from the direct effect on fever and on pain, mefenamic acid also reduces the prostaglandins and other inflammatory cytokines. So it reduces these harbingers of pain, inflammation, uh, stiffness, muscle stiffness, like you said, and they act upon the joints, the muscles, the bones, all of them. So that's another added advantage. Another difference between mefenamic acid and paracetamol is that paracetamol has a light effect, central anti-inflammatory effect, while mefenamic acid has both central and peripheral effect. Sir, what about speed of action? Uh, Now, when somebody gets fever, they become very impatient. They want fever to resolve very fast. So, would mefenamic acid be faster, or would paracetamol be faster if we want swift relief of pain?
I think mefenamic acid is faster than many of the medication, including the paracetamol. And as you very rightly said, it is working on the central mechanism also. So many a times it is very good in the neuralgia also. Pain of the neurological origin gets relieved very nicely or very effectively when we are using the mefenamic acid. So this is not only simply a broad spectrum uh, pain reliever, but it also works on the mechanism of action of the pain, especially it may be neuralgia, it may be central mechanism of pain, or it may be the inflammation which is working peripherally at the local site. So that's why it works, and it could be a very good option in such kind of the situation.
Vaishnavi ji, Prashant ji, and Akhilesh, thank you for your answers. And actually, sir, I have experienced the same. We use a term called moan syndrome, MOAN. Moan means moans and groans, like the pain that a patient will present with. But the patient will not come and say that, sir, I have got a neurological pain, or madam, I have got a muscle pain. They will say, I have a pain. MOAN means musculo, osteo, arthro, neuropathic syndrome. So the pain can be because of muscle, bone, joint, or nerve disease. And there is no rule to say that if I have neuropathy, I cannot have a myopathy or I cannot have an arthropathy. So this I have seen in my practice as well. When we are treating patients with maybe diabetic painful neuropathy, we have done the best, we have followed the guidelines, patients are not responding to treatment. Then, like Satish ji and Jayesh Modi and Vipin Kumar say, we sometimes add a small dose of mefenamic acid for a few days. It will not work in everybody, but it works in many, many, many patients. And the drug is safe to use. You just have to give it for a short period of time. So, this Moon syndrome is something that we can speak about to our patients and to each other. And we can say that we are giving you, the way Professor Anuj coined this term, a broad spectrum pain reliever with multiple mechanisms of action.
Yes,
Sir,
yes.
Raman Ikramuz is with us and also Pratibha Patilji. And they say, let's talk about specific situations. So, Vaishnavi, Pratibha, Vishnu Pawar, and someone who has such a beautiful DP. Sir, उनका नाम है फुकरों का स्टेशन. तो ये पूछते हैं कि सर, what about women's health? Can we use mefenamic acid in, let us say, premenstrual syndrome or in dysmenorrhea?
In fact, very much it is used in dysmenorrhea. I have seen obs-gynae experts are fan always for the mefenamic acid. Initially, I was really amazed many of the times whenever I saw that prescription coming from the some obstetrician or some gynecologist. They were writing the mefenamic acid for the dysmenorrhea. But as I already said, this is working on multiple mechanism of action at once. So this gives very good results in any very severe pain. It's not only the dysmenorrhea. Dysmenorrhea is one of the very severe pain which is faced by even young girls, and they are not really they are tender young girls, and they are not really very much having the tolerance power to bear the pain. And once we give the mefenamic acid, their pain is relieved earliest, and that is the thing which we really look for. And the pain is gone immediately. And same thing happens when we see the pains which are occurring around because of the cholecystitis or even other inflammatory mechanism which is going on in the body. And if we use the mefenamic acid, immediate pain relief comes much earlier as compared to the other pain relievers.
Thank you, sir. And Vishnuji, Ravinder, and Suman say, sir, you just used the word young girls. So, is mefenamic acid safe in the pediatric age group? And how often, you have been a parent also, so how often do parents worry about having to wake their children up every 4 hours to give paracetamol? Is mefenamic acid safe for the child? Is it also helpful? Does it reduce the distress of the parents while they are managing their children with fever at home?
Yeah, I think it is safe even in the childhood, not very early childhood, but in the childhood more than 6 years of the age, it can very easily be used. And although I'm not a pediatrician, so I can't say very early childhood about. You may be having this information, you can definitely tell. But as far as the young girls are concerned, above 9 years, above 6 years, and even in the boys also, I have used this medication and. Found to be having good results. Not now, but when I was uh, working as a non-MD practitioner in my internship days, or in when I was working in some hospitals there, and I was looking for the non-specialties patient also. Nowadays, I am strict to my specialty, so I usually don't get kids to see myself. So I don't have really much experience about the kids.
Sir, what about the elderly? Now, nimesulide is a drug that is used, and there is a fear always that nimesulide can cause fulminant hepatotoxicity. So, is mefenamic acid safe in elderly people with good renal function?
I think you are very correct because nimesulide is a pain reliever which is very much popular among the population. People take it over the counter. People use it without asking even clinician or doctor, without any medical prescription. They use this, and as it is very well known, it causes fulminant hepatitis. Apart from that, it is having more GI adverse effects potential too. It is causing more of the gastritis. It is causing more of the peptic ulcer. It is causing other all the other NSAID problem which may arise can be with the nimesulide more commonly. Even it is also supposed to be more nephrotoxic too. But despite that, it is too much use. So definitely, mefenamic acid is much safer as compared to the nimesulide and these kinds of the medications which are very popularly being used by the population. Mefenamic acid, as far as side effects are concerned, it is having the least amount of the side effects. Very little adverse effects we have seen to be occurring with the GI adverse effects, and also we could not see much even with the other kind of the things like hematuria, which we usually see with the NSAIDs. But we don't see much hematuria even with the using mefenamic acid. So that's why I always think that it could be even safer for the elderly population, and elderly population can be given the mefenamic acid choice better and more comfortably. Although if it is first to use this thing for the elderly patient, more those who are in their 60s or 80s, I would definitely prefer to use paracetamol first. Once the paracetamol will not be working, then definitely I would go for the mefenamic acid. It is because of their tenderness. But effectivity is concerned, then there is no match of the mefenamic acid.
So we see, sir, this power of three coming up, and Satish ji, Yogendra ji, and Nishant is from Siddharth Nagar. They greet you. So do Sandeep, Anurag, and Vidya, sending a good evening your way. We see this power of three coming up now, Professor Anuj. Let's try to put everything into a few words. The first is three effects that mefenamic acid gives us: anti-fever, anti-pain, anti-inflammatory. The second is three other unexpected benefits. The first is antiviral, which we discussed at length. The second is an anti-helminthic. If you have a worm infestation, mefenamic acid works on that as well. And the third is neuroprotective. You can use it in neuralgia as well. So, three unexpected benefits: antiviral, anti-helminthic or anti-worm, and neuroprotective. The third power of three would be used in different phases of life. You can use it in children above the age of 6 months. Even a six and a half month old infant can take mefenamic acid. Just be aware of the dose. It's 7.5 milligram per kg body weight. So, in infants and children, adolescents, also in women's health, you can use it for dysmenorrhea, PMS, and you can use it in pregnancy after 30 weeks. Try to avoid using mefenamic acid before 30 weeks of pregnancy. And the third, like Professor Maheshwari pointed out, is the elderly. You can use it safely without fear of hepatitis. So we have three into three, power of three. And if we can add just three more, that would be, I think, safety, efficacy, and tolerability. So we've spoken at length about safety and efficacy. About tolerability, sir, Naveen, Shubham, and Dinesh have a question. Shubham Singh and Shubham Navpute both. Sir, mefenamic acid is an acid. So will your patient ever come and tell you, sir, already I have a lot of acid and this tablet is going to worsen me? Is there acid in this tablet? Should we not take it if we have acidity?
No, this is a chemical name of the tablet. It is not actually the acid, which is a kind of the acid. What we really scare of that. It is a medication which is having the chemical name, which is acidic in its nature. That's why it is using the word acid. Like salicylic acid. Salicylic acid is also the using the word acid, but it does not mean that it is acid. So that we should not use. So anything which is in the medicinal amount, any acid even medicinal amount is not harmful. When we use in our kitchen the vinegar, we use in our kitchen the various kinds of the acid in the small form, very little form. So these acids are not harmful in when they are used in the appropriate permissible amount. That it's the same with the mefenamic acid. Obviously, if you will be using it more than recommended amount, then definitely it will be working like an acid, and you will find difficulty to handle this.
Yes, but it's not that the pH will come down. So it's a safe drug to use. So going on with power of three, safety, tolerability, and efficacy all are there. If we focus on efficacy, we have another power of three. So it is swift. Like Dr. Maheshwari said, this is the fastest acting antipyretic. Within 1 hour, you have a result. It is also sustained because the duration of action is longer. So you can give the tablet twice a day. You don't have to give it 4 hourly or 6 hourly. So it is swift, it is sustained, and it is sufficient. It will work even in patients where paracetamol alone is not working. So many powers of three. But sir, a question coming from Dinesh, Deepak, and Akhilji, and also Vinuta Anil Kumar. They ask, sir, recently there was a furor in the media about something called dress syndrome. So one point blank question coming from them and also from Manoj and Kian, sir, have you ever seen dress syndrome in your patients?
Yes. In fact, dress syndrome is a simply a response of the over medication uh, for any anti-inflammatory. That may be not only because of the mefenamic acid, any NSAID can give that, in which we can get some drugs, rashes, some itching, some inflammation, and that maybe looks like that allergic rashes are coming up. So in such situations, any medication whatever we use in our day to day practice, that is not free from the side effect. So any medication is can get this. whenever we are using the medication, we have to think about the pros and cons and benefits, and we have to weigh the benefits and harms of those medicine. This stress syndrome is not a very common phenomena, very rare phenomena, which is seen very rarely, where the eosinophilia counts are raised and where we get the rashes are coming up and itching is coming up, and but it gets subsided also after the stop when you stop the medication. So it's really not a that kind of the thing because of which we should be forbidden to use these medications for the same. And even many of the other NSAIDs are coming up with the Steven Johnson syndrome, and we all know that Steven Johnson syndrome many of the times is uh, very dreaded to be treated. But stress syndrome is not that much. It's very mild as compared to that. So we can definitely use it. It is not a toxic thing, but not that toxic thing which for which we should stop using the medication.
So, sir, Amol, Sridhar Kulkarni, Bajrang Sharma, and HK Rock. I love some of these names. Don't they make you feel younger, sir, Doctor Anuj? HK Rock and Fukre Gang and stuff like that. It makes you feel happy, doesn't it?
Yes, yes. Uh,
So, Abhijit Anand, Anand also means bliss in Sanskrit, and Shubham Sharma. Shubham means Shubh Mangal, everything good. Would we be right in saying that mefenamic acid, when given in the right dose to the right person, for its antipyretic, anti-inflammatory, and analgesic properties, will actually create Anand in a very sattvic manner?
Yes, definitely. We should give this medication in appropriate dose, and we can give it this in a maximum permissible dose. We should not go excessive of that. And if we are anytime we are using this, and never we should take without prescription of uh, physician any NSAID, because NSAID is not a thing to be taken over the counter. And I believe that how much dose and how much the frequency of the medication is required is to be decided by the clinician, not by the patient himself. So always we should keep remember this thing whenever we are going to we look for our clinician to decide the dose.
It is 7:30 p.m., sir. We acknowledge the questions and comments from everyone, but I would like to take one name, sir. This is senior colleague of ours, Dr. Rameshpal Singh Pawar, sir. He is a 73-year young pediatrician from Saharanpur in Uttar Pradesh. And Dr. Pawar asked, sir, can you just summarize for us in one sentence the take-home message? Like one take-home message you said was we should not self-prescribe. But what Dr. Pawar sir is asking is, can you summarize the safety, efficacy, and tolerability of mefenamic acid in one sentence, please?
Yeah, in one sentence, I can say this is the fastest antipyretic, very effective anti-inflammatory, and very effective pain reliever for the any patient who is in the agony of the patient, agony of the pain, and where you can say that you need to use very strong medication, a strong pain reliever without any side effect and without and least amount of the side effect you can say. So mefenamic acid can be used in a way.
Thank you so much, sir, for your time, your expertise, and thank you so much for explaining this difficult topic in such a simple word. I'd like to
Thanks for
thank
the
everyone who
invitation.
has logged in with us. Thank you, sir. Thank you. Shukriya, Dhanyavad, Meherbani, and Jai Hind, sir.
Thank you, sir. Thank you.